Anyone working in the NHS at the moment will know just how challenging and difficult it is, and Lambeth's no different in that.
I think we all feel very pressurised at the moment. We're all working very long hours.
So it's hard work, and I guess it's been more hard work as the years go by. But it's interesting in Lambeth. There's a great variety of patients, great variety of clinical problems.
I'm still enjoying being a GP. I like the patient contact and the continuity that I can offer as a GP. At the moment it does feel very pressurised and quite hard work, and I'd like to see that change.
Well, it's exciting. There are lots of challenges going on with current changes happening in Lambeth and nationwide. I think in Lambeth we're really lucky because we have a lot of really good support.
I think we all have a responsibility on a day-to-day basis to see small problems and try and solve them.
I think the problem for us at the moment in general practice is that we seem to be starved of resources, not necessarily just cash, but generally starved of resources, and we're being expected to do more and more for less and less. And I think unless we can find a positive and well-structured way of changing that, I don't think we're going to be able to improve things.
GPs for decades have always taken a holistic approach and are keen to have the patient at the centre, but I think really embracing that in a wholehearted way is something that perhaps there's more for us to learn about that, more for us to get our heads around about what it really means.
I think we need to move towards a much more proactive system that's able to not just respond to people's ill health, but to support them as best we can to keep them as healthy as possible, to be much more proactive, to think in advance of how we can help people and support them to keep themselves healthy. Where they do need support, to respond really quickly, to get involved with them, to get their care in place, and then to help them to recover as quickly as we can and go back to independence.
Primary care is absolutely at the centre of it.
Well, my feeling is that we can be the major driver for change.
We can take responsibility within our practices to set the standard of care really high, but set a good example about looking after ourselves, about working closely together within our practice teams.
General practice has the ability to see people in the round, to look out to their lives, not just to see beyond a single condition. So I think there has a huge opportunity to get involved in being more proactive.
It would be great if we could all work as a sort of multidisciplinary system to encourage best practice in all our practices. Another area would be to have a sort of bank nursing requisite, so that we could actually have a pool of nurses that we could use to work in practices where they are struggling with recruitment and retention.
The only way we're going to improve things is to work with secondary care colleagues, and we just got to keep communicating. I think when you really get clinician to clinician discussion across that divide, we can do amazing things. Just take one example, look at the local care record.
So I think we need to build our partnerships to address those kind of really frustrating issues that get in the way of holistic and rounded care and support. So for example, sharing health records.
The vehicle that's come over the horizon for that is the local care networks, and if we can make these work as a place where we're all working together, then this is going to be really crucial, and we must make sure that the patient is a part of that.
I do think though in Lambeth we've got a greater opportunity than most to continue to secure improvement though, and to keep our heads above water to that extent. And if you ask me what keeps me going and keeps me motivated, it's probably the people I work with. So people I work with are hugely committed to what they do to improve health in Lambeth. They're pretty skilled, and they've got huge ambition to set their talents to keeping us going and keep us improving.
I think we can do quite a lot to improve joint working. I think the biggest thing that faces us is this us and them attitude about them in the hospital, us in the community, them here, them elsewhere. And I think if we can look at working together across some of these boundaries and communicating more effectively with colleagues in different parts of the system, I think we can do an awful lot to improve patient care.